For a country of 1.3 billion people that spends less than 2% of its GDP on healthcare, India's sprawling healthcare system is overburdened even at the best of times. With the coronavirus pandemic, the system is facing its biggest challenge yet. Millions of patients across the country no longer have access to basic medical care. And inside the hospitals, doctors too are struggling to cope with this new reality.
Most of the healthcare services are limited or shut down. The main emergency are the people with other illnesses may land up in COVID emergency with added COVID infection. So it is very difficult to segregate.
Dr. Srinivas Rajkumar is the General Secretary of the Resident Doctors Association at AIIMS. With doctors and nurses already testing positive across the country in large numbers, he is a worried man.
We are sending soldiers without any protective suit or the sufficient ammunition to fight this battle. There are certain places in the country, even very good hospitals, providing raincoats and jugaad kind of like made in home kind of gears, helmets, face shields, whatnot. It is very horrible to see.
And it's not just shortage of personal protective equipment that's a problem. According to one of India's leading epidemiologists, Dr. Ramanan Lakshminarayan, the country may soon stare at a shortage of medical workers.
You know, to me, this is the number one issue with our response. We can buy beds, we can buy ventilators, we can buy personal protective equipment, or the country can make these. What we can't make at very short notice are actually medical providers. I think we need to emphasize personal protective equipment and infection control for all of our health workers, not just doctors, also nurses, all healthcare providers.
Every morning, Salma bathes her 7-year-old son Ayan in a discreet corner right outside the country's most prestigious public hospital, AIIMS in New Delhi. A few months ago, doctors in the eastern state of Orissa, about 1,500 kilometers from New Delhi, told Salma that her son needed a complex neurosurgery. The only doctors who could perform it free of cost were at AIIMS. The family arrived in Delhi on March 2nd. They found beds in this crowded shelter and settled down for what they hoped would be 2 weeks. With the lockdown in place, the hospital has closed many departments to prevent the virus from spreading.
हम लोग को बोले हम लोग फोन करेंगे जब तब आइएगा आप लोग का होगा तो हम लोग सोचे 10-15 दिन में हो जाएगा और अभी तक तो कोई फोन नहीं आया कि कोई हम लोग के साथ में कोई सलाह मशवरा कुछ बात नहीं। आप सबसे निवेदन है कि आप सोशल डिस्टेंस मेंटेन रखें।
For all the patients here, the biggest problem is finding food.
ऐसा कोई गारंटी नहीं है कि आपको हर चीज़ यहाँ पर ही बैठा के खिलाया जाए। जो मिल जाए, कोई सूखा रोटी पकड़ा के चले जाता है तो खाली कोई खिचड़ी डाल के चले जाता है थाली में। बस ऐसे ही है, यही जिंदगी यहाँ काट रहे हैं हम लोग।
There are at least a dozen tents of this kind on either side of the road outside the All India Institute of Medical Sciences. Now there are at least 20 people in each tent, some of them suffering from very grave ailments like cancer, others waiting for major surgeries like neurosurgery or cardiac transplants. As night falls on New Delhi, Indians step out of their homes to light candles for the brave healthcare workers fighting this pandemic. In recent days, many doctors have said that these are meaningless unless backed by supplies of much-needed personal protective equipments.